everyone. Welcome to the Nurses Heartbeat, where every heartbeat tells a story. So, in this episode, we are going to look at the episode 2 of the NCLEX Unlocked. This is where we talk about the test plan. So, in the previous episode, we look at the general overview of the NCLEX exams, the format, and all of that. So, this one, we are looking at the NCLEX test plan. So, what is the NCLEX test plan? So, the NCLEX test plan is a detailed structure that has been set by the National Council of State Boards of Nursing, the NCSBN. The NCSBN is the body that is responsible for the NCLEX exams process. And then they have a document to tell every NCLEX taker, exam taker, which specific aspect you should learn or which specific area you'll be assessed on. And basically that is what they do. So today we are going to look at this test plan so that everyone out there that is doing this NCLEX exams will know what actually they are supposed to learn and what they will be tested about in the NCLEX exams. So let's have a quick breakdown of the test plan as per the NCSBN protocol and what they expect every NCLEX taker to know about. So it is divided into 4 main groups or categories. The first one is the safe and effective care environment. So that is category they will assess you on if you want to write the exams. I will break them down shortly. I'm just mentioning the various categories that is available for now. And the second one is health promotion and maintenance. You'll be assessed on this area as well. The third one is psycho-social integrity. And the fourth one is the physiological integrity. So I am going to explain what these aspects mean and how you'll be able to prepare for the exams, your questions according to these headings or guidelines. So let's dive into SAFE. So the first one, I made mention of the safe and effective care environment. So under that, we are looking at management of care and safety and infection control. So under safe and effective care environment, we are going to have questions about management of care, about safety, about infection control, everything that amounts to safety of care for both your patient, both the working environment, and all of that. They are going to test you under this topic. So here we also are thinking of delegation and prioritization and preventing harm. So, as a nurse or a midwife, you are expected at some point to delegate tasks to the carers or to the healthcare assistant, or you can delegate to the nursing associates. In other jurisdictions, they call them enrolled nurses. In other aspects, they call them the practical nurses or the vocational nurses. So either you are delegating care to your junior nurses, to carers, and all of them, the right delegation process, they are going to test you on that as well. And prioritization, you may be having more than one patient and the patient may have different needs. How are you going to prioritize these needs and which patient are you going to assess them or care for them first? So under safety management, they are going to test you on prioritization as well. And preventing harm. What is the best way to care for your patient and prevent harm to this patient? They all come under this heading. And then the second one is health promotion and maintenance. So under the health promotion and maintenance, we are looking at lifespan growth. So lifespan developmental milestones, and all of that comes into health promotion and maintenance. We are looking at pregnancy. So that is where you'll be tested about topics like eclampsia, preeclampsia, and pregnancy related topics, and then screenings as well. You'll be dealt into screenings and immunizations. So this is where you are supposed to know your vaccinations, your immunizations, pregnancy questions, developmental milestones. They all come in under health promotion and maintenance. And then the third heading or third category is the psychosocial integrity. So, psychological, psych is to the mind. So this will be more of mental health issues, and then communications. When you have patients with dementia, you have patients with Alzheimer's disease, you have patients with other mental health conditions, how you are going to communicate with them, how you are going to respond to crisis. You have patients with suicidal thoughts, suicidal ideations and tendencies, and then they are telling you what they want to do. They want to commit suicide and all of that. What is the best response you should give to this patient? So more about communications and response to crisis. That is what is assessed under this heading. Yeah, basically. So about mental health coping mechanisms and crisis intervention. And then the last and the major category is the physiological integrity. So under physiological integrity, this aspect carries a lot of weight, and then in the examinations, they are going to ask you more about this topic. And then it's about your basic care, your pharmacology, your medicine, and your surgery. So that is about physiological integrity. So this is where you are going to bring your idea about your nursing care, your medicine, your pharmacology ideas, medications, and how you apply, how to handle allergic reactions and all of that, side effects of medications and everything that comes under physiological integrity. And this has very weight on the exam, so it takes about 40 to 50% of the whole questions that will be tested upon in the examination hall. So let's look at how to use the test plan in your study. So the strategy to use these test plans. So once you can print this 4 test plans I have told you, when you go to the NCSBN website, it is free. You can download it so that when you are learning, you'll be able to group your questions you are learning under each of the 4 test plans that I have mentioned about. So you can download it to just look at that. And the tips that you need to do is to match your study topics to the categories in the plan. So if the question that you have been given is about delegation, is about prioritization, you know that you are solving questions under safety and management. If the question is about vaccination, pregnancy, then you know you are going to health promotion and maintenance. If your question is about suicidal tendencies, depression, anxiety, then you know you are going to psychological integrity. And if it is about medications, pharmacology, medicine, surgery, basic nursing, basic care, then you know you are going under physiological integrity. So once you download it and when you are answering the questions, you'll be able to know which aspects the question is falling, and that will help you to better plan and better work on the questions you are doing. Because let's say, for instance, you are getting questions correct on, let's say, psychological integrity. You you get the questions there. When it comes to questions about depression, anxiety, or mental health conditions, you are getting them right. But it comes to physiological integrity, when they ask about pharmacology, drug, for example, you are going to administer digoxin to a patient. What is the things that you have to consider? So when you come and you realize that you are getting some of these questions wrong, then you know which aspects you is your weakness, and that means that you have to work on your weakness very well. And as I said, you know, the questions, they all have the percentages. So if, let's say, the physiological integrity, that will amount about 40% of the whole test. If you constantly getting questions under this category wrong, then it means that your chances of passing the exams is also low. And then it will help you to know which aspects you are weak, which aspects you are strong. And then in the NCLEX test plan, you focus more on your weakness and you try to work on it so that you can get better on that aspect to increase your chances of passing. Quick tips for studying by category. I may have mentioned some of them, but let me give you a bit quick of one. So for management of care, learn delegation and prioritization rules. So you have to go back and then delegation, how to effectively delegate tasks to carers, to nursing associates or practical nurses, or vocational nurses, the LPN. So when it comes to the NCLEX, the Band 4 nurses, that is the nursing associate, or some jurisdictions, they will say the enrolled nurses. They normally call them the LPNs, practical nurses, vocational nurses. So if you are delegating a task to them, or you are delegating to your healthcare assistant, what are the right tasks you need to delegate? So you have to revise that so that it will help you to be able to answer questions when it comes to the management of care. And then for health promotion, as I have already said, your vaccinations and your developmental milestones, you have to take them seriously. In the next episodes, how I was able to master vaccinations and developmental milestones, I will share some of them with you. And then I have friends that have passed the NCLEX exams, and when they are available from time to time, I will get them to also share their experience on how they are able to get they were able to get some of these things. Sometimes it is quite difficult mastering something like developmental milestones, nations, how to master them, and all of that. I will be bringing you tips on how you'll be able to do them as well. But that is what you have to know under the health promotion. Know your vaccines, know your developmental milestone. And then for psychosocial integrity, you are going to master therapeutic communications and crisis response. I have already talked much about that. And then physiological integrity, you are going to look at we are going to focus on disease processes, understand the disease processes. This is where I recommend books like the Saunders. So if you have Saunders, it gives you the details about the disease process. So if you want to look at renal diseases, you'll be able to have a look about all the disease process. It refreshes your mind about the physiology of the disease process, disease mechanisms, and all of that. And then you'll be able to understand fully what you need to know, so that when the question comes, it's not like you are trying to guess, but you understand the mechanism of the disease process. And then your lab values is very important, because they are going to test you on lab values. So things that are very important, they will test you. Let's look at things like your potassium, the value for the potassium. You need to know your sodium, because when a patient loses potassium or is having higher potassium in their bodies, has a great effects on their general health. So potassium, calcium, sodium, these and few other things you need to know, your lab values, your things like the EKG or ECG, you have to know about them, how to determine if patient is having normal sinus rhythm, AF, and all of that you have to know about them. They all under this physiological process. And then also your safety risk. So when you are administering a medication, what should you observe? These are all important things. So let's say, for instance, you are going to give medication to patient who is dependent on morphine, then probably what are the side effects? You have to know all this one so that when any present, you'll be able to know how to handle it. And these are the things that NCLEX is testing you on to know how safe. It's not about knowing the disease condition or knowing medication you should give when patient is having, let's say, high blood pressure, but also knowing the immediate side effects of you giving the antihypertensive medication and what you should expect, and if any adverse effects happens, how you are going to handle it. Those safety bits are very key to the examination board, and that is what basically most of the time they look at and they want to test you on. Yeah, so that is it for rate the test plan, and then questions that comes under various categories. That is what you should know. And then what is next? So this is the roadmap that you have got. In our next episode, we are going to take you through a very steady plan, powerful one that fits into your timeline, that fits into your personal space, and then you are going to work around this timelines and this steady plan that will help you individually, because how one person learns will be different from the other. So how individually can fit into your schedules, and you'll be able to study and pass your exams very well. If this has helped you, I want you to I want you to subscribe, I want you to share to your colleagues, share to your classmates, share to your groups and everybody, and then leave any comment. If you have any question or anything, just leave it in the comment section. Let's keep the discussion ongoing. If you are a new viewer, we welcome you to the Nurses Heartbeat. Want you to subscribe because we have a very great stuff for you. If you are a nurse or nursing student, if you are a colleague or anybody at all, you can subscribe because we bring you a lot of issues about nursing, licenses, registrations, work area issues, and everything about nursing and midwifery. My name is Philip once again, and this is the Nurses Heartbeat, where every heartbeat matters. See you in the next episode. Remember, you are strong, you are confident, you are just a step away from passing the NCLEX. See you.